how many of your patients had 3, 4, and 5 of these risk factors, which puts them at a increasingly urgent rate of needing us to step in and do prevention in order to prevent them from having caries. Think about the patients that you've seen in the last month. How many of your adult patients who are at risk of having caries or who have active caries were ever offered fluoride varnish or given prescription fluorides to go home with and provide home care? So looking here, we move to treatment even if you don't need to drill. So we'll have here one of these lesions in the blue, where the blue arrows are, where it's less than half into the enamel. Where the yellow is, it's greater than half in the enamel, but we can still remineralize at that stage and prevent and monitor. And then, of course, your pink is already in the dentin, so that's where they would consider to cavitate. My son will be, 40 years old, I believe, this coming year, and he's never had a carious lesion in his life that had to be filled, only those that needed remineralization. So it does work, but we do have to be able to identify it and intervene before they get to the stage of needing cavitation. This is a great chart, and I hope you guys utilize this, which talks about how we can move forth on that clinical pathway for non-restorative treatment for our patients. It talks about what to do with an occlusal, on an proximal, and then anybody with a lesion on the facial or lingual, and then, of course, on the root surface. Traditionally, preventive care has always been left to the hygiene visit. Why should this not be something that the entire team utilizes? Sometimes we're not going to see every single patient in hygiene. So let's expand the hygiene preventive model to a team prevention model. And honestly, when a patient is going through restorative treatment, they are the most highest risk at that particular point. Let's start treating them preventively after they receive that restorative in the dental chair with maybe the assistant. If they have an active carious lesion, there are other areas in the mouth that are demineralized that we just have not been able to identify yet. So waiting till that patient goes back to hygiene, maybe they won't, maybe they will, to do their prevention. It's a perfect opportunity right after that filling is done, after that temporary crown or permanent crown is placed, that the fluoride varnish become an automatic at that point. Hygiene only preventive model is not enough. We need to fill in those gaps. So let's look at other ways that we can close the gap on prevention and treatment of this disease. We have the missed hygiene. That's the person who keeps missing that appointment or keeps canceling. So maybe they should have been in at 3 and they should have had, whether it be their perio maintenance and their prevention treatment, but they keep missing it. What about the 6-month recare? Like I had mentioned, some people really don't have a lot of biofilm buildup, but they're at a high susceptibility for a carious lesion because of other factors. It's always baffled me why orthodontists do not do fluoride varnish. Patients with dentin sensitivity, and then, of course, your patients that are going through cancer treatment. These are all of the areas that we have missed opportunities that the entire team approach could help. You want to make sure, even in your prevention models, you're maintaining that standard of care so you know that you did everything possible that you could to help prevent carious lesions or a tooth loss. Making a change is always difficult and challenging. So let's just look at our highest risk patients. Let's look at our patients that have cancer therapy. All and every single one of them should be enrolled in a caries management system or protocol, whatever you want to call it. Patients who have new decay. So let's just look at those 2 first and incorporate it into those 2 highest risk patients in the very earliest stage. You will get more comfortable with it, and then eventually open it up to some of the other models that I had shared where the gaps are. Provide the CMS steps to all new patients as well. When you incorporate any new system or protocol in a practice, it's really, really good to start with your new patients because they don't know any difference and they can't say, why didn't you do this last time? Or I've never needed this before. Set a reasonable fee for your fluoride varnish, and then commit to being proactive in disease management instead of reactive.